My name is Murtuza. I'm a consultant paediatrician working at the baby clinic, and I look after children from birth right up to their 17th year. A paediatrician is essentially somebody who looks after children's health. Most people who would regard themselves as paediatricians would be general paediatricians, and that means looking after common ailments that children have, from respiratory problems to bowel problems to neurological problems from birth all the way up to their 17th year. I suppose we predominantly see children in the first 4 or 5 years of life compared to the other ages. And in general, we would be concentrating mainly on food-related problems, nutritional problems, respiratory problems like asthma, illnesses associated with allergy, and neurological problems like headaches. Children, when they're not thriving properly, especially in the first 2 to 3 years of life. I often get involved in children who have anemia, looking into the causes of anemia. I also manage children with vitamin deficiencies. In the United Kingdom, vitamin D deficiency, for example, is very common, and therefore that also takes a substantial chunk of my management. Yes, we tend not to perform or give routine advice regarding first aid to new mothers regarding their newborn children. Usually the scenario is that children who or their parents who have received this training would have been where there's been a circumstance where an issue has arisen. And this issue is usually often associated with children who've had difficulty in breathing or have what's called funny episodes when they've been perhaps they've been suffering from stopping breathing or even having a sudden color change. So in these situations, there is often anxiety all around, and we try and reduce this anxiety as much as we can by giving parents specific training in this area. At different ages after birth, children will have different symptoms which mean different things. So, for example, if a child has fever, any child or newborn baby that has fever within the first 2 to 3 months is extremely important and must be taken very seriously. There are other symptoms, a child with persistent vomiting, a child who is suffering from very loose stools and as a result is not putting on weight. Feeding changes can be very important. What I normally say is that if a child is persistently taking less than about 60 to 70% of their normal feeds, then that can be a sign of some brewing problem, like an infection or some other internal problem. Sometimes some children will have a change in their crying pattern, and this has to be taken seriously, especially when this involves them becoming irritable and also developing a high-pitched crying pattern. This can sometimes indicate development of meningitis or similar infections in or around the brain. Babies vary in their skin color normally. Some babies are generally a bit pale, others are pink, but it's the change in color which can be important. So if a child changes from being pink to persistently pale or sweaty or even mottled in appearance, that has to be taken very seriously, as again it may indicate the development of a more severe infection. A good feeding pattern is something that some babies take some time to develop. It often changes with babies sometimes taking anywhere between 10 to 12 feeds per day to other babies often feeding every 3 to 4 hours within the first few days of birth. However, every baby should be regarded as being different, and often it is the change in their pattern which can give an idea or give a clue as to whether the baby is developing a more serious problem. With this change in feeding pattern, other things to look out for might include, for example, is the baby's change in pattern due to the child struggling with the feeds. One of the commoner presentations of a child with a heart problem, for example, would not only be a change in color, as in sometimes babies begin to go blue, but also they take longer to feed, or they get breathless while feeding. Anytime a baby develops a fever, in the first 3 months of life, the baby should almost always be seen by a specialist. This could include your general practitioner, or if a general practitioner is not available, then the nearest A&E department. Other conditions or situations where one would recommend that your child is seen urgently would be if they start having sudden color changes or have patterns in their breathing where they have a pause for prolonged periods and then they begin to breathe again. This is a condition that we call apnea. Any baby that has sudden jerking movements or persistent jerking movements of any arm or leg, and especially if it's associated with abnormal movements of the eyes, should always be taken seriously, as it may indicate the development of seizures or fits. Babies possit or vomit very frequently in the newborn period. Most of the time, the cause is actually gastroesophageal reflux. This can occur a few times per day, and occasionally it'll occur with every feed. Importantly, however, in this situation, the child will actually keep most of the feeds down and will actually put on weight satisfactorily. There are, however, some situations where the vomiting is more severe, it is more forceful and possibly even projectile. If this occurs and it is occurring consistently, then children should be seen as a matter of urgency, again by the general practitioner or the local A&E department. Colic is a condition that occurs normally in the first 4 to 5 months of life. It is classically described as a state where babies cry incessantly for periods of up to about 30 minutes or more. And despite all sorts of attempts to comfort the baby, they are very, very difficult to settle down. Most of the time there is no obvious cause for the colic, but occasionally colic can be a manifestation of infection, as in urine infections. It can be a manifestation of bowel problems, as in different types of obstructions in the bowel. Certain types of allergies, and in particular cow's milk protein allergy, can present with severe colic in the first 3 to 4 months of life. A clue to this would be if a baby was introduced to a formula feed, having been breastfed up until that moment, and then she suddenly or he suddenly begins to develop severe screaming episodes. There are, of course, other causes, but these would be the sort of things that I would consider in the differential diagnosis. So colic can be actually very difficult to treat. Unfortunately, there is a lot of advice regarding the management of colic. Some of this works, a lot of it doesn't. In reality, it is a matter of trial and error to see what suits your baby the best. The good news is that eventually colic does disappear, and usually it is at around 4 to 5 months of age when most babies become asymptomatic. Well, fortunately, most allergies begin to manifest in newborns well after the first 2 to 3 months. The underlying process where they are becoming what we say sensitized, however, is continuing even at that stage. But all the evidence suggests that during this period they do not show any symptoms, and these symptoms begin to develop later on. Things like allergy to cow's milk, allergy to egg, and occasionally allergies to other foods. But it is commonly in the first year of life, those first two foods. And these would often be manifest by obvious symptoms, including the development of rashes, children's lips and eyes or different parts of their faces swelling up, often associated with vomiting. And very rarely will they cause difficulty in breathing or other generalized symptoms. Certain types of food allergies, however, do not cause these immediate acute symptoms. They tend to cause more prolonged low-grade symptoms, and this is more common in children with eczema. It's estimated that in the United Kingdom, around 30 to 40% of children with eczema will be sensitized to certain foods. And so if children eat or drink these allergens, then essentially their eczema gets worse over a period of days, rather than acutely, as in the first type of allergies I've just spoken about. So these are probably the two of the commonest manifestations of allergy in the first year of life. Fortunately, most eczema is either of mild or moderate severity, and often a combination of emollient creams and occasionally low-grade topical steroids used on the skin is enough. However, in children with eczema, nearly 30 to 40% of children do have significant food sensitization, and therefore these children should, especially in the first year of life, be assessed by an allergist to exclude these particular foods as a cause of their sensitization. There are, of course, other ways in which allergies can present, but these would generally be rarer. Cow's milk protein allergy can present with severe colic. It can present with severe uncontrollable gastroesophageal reflux. Occasionally it will cause just severe constipation, occasionally alternating with diarrhea. I have seen children present with severe allergies which, because they were largely mismanaged, eventually caused them to fail to thrive and also caused developmental delay and fits. So these are some of the more rarer presentations of allergies. One of the areas where there's often a lot of concern in the newborn period is weight gain or even weight loss. It is generally recognized that babies can lose anywhere up to at least 10% of their body weight from birth within the first week or two of life. Now, this weight loss is normal, and 99 times out of 100 does not signify anything serious. Occasionally babies will lose even more than that, 15% or even more, and they will still turn out to be all right most of the time. Coughing is a very, very common symptom in newborn babies, and also later on in life. It's estimated that in the first year of life, newborn babies can have anywhere between 5 to about 10 or even 12 new infections, which are usually viral in origin, and a lot of these will cause episodes of not only a runny nose, mild fever and going off feeds, but coughing. By and large, this coughing is not usually one that goes on for more than about 1 to 2 weeks. Occasionally it go on for 3 to 4 weeks, and very rarely will it go on even longer. Some of the features associated with coughing which should prompt parents to take the cough a little bit more seriously would be if the coughing is associated with any difficulty in breathing or persistent wheezing, or if there is a persistence of high fever, or the coughing is so severe that it's regularly causing a baby to vomit with the coughing spasm. This can sometimes cause significant problems, even in the short term, of nutritional difficulties. Especially in the first 2 to 3 months of life, children can have a lot of variation in the normal stool color, frequency of bowel action, and the actual texture of the stools as well. Variations from dark brown to yellow to occasionally being a bit pale down to dark green or light green will probably all be regarded as within the normal limits. If a child persistently passes black stools or at any stage passes blood in the stools, then that needs to be usually taken a little bit more seriously. Of course, if a child is passing pale stools, for example, all the time, then that has to be taken seriously as well, because that could indicate problems with malabsorption or other problems with the gastrointestinal tract. In all of these situations where one is concerned about stool frequency, texture or color, it is very important to take into account other general developments, like is the child, for example, thriving? Is he tolerating his feeds? Is he generally developing normally from a neurological point of view? All of these things are often interrelated, and it's important to be able to sort of look at the child holistically to get an idea and focus on the main problem. If an adult or an older child develops a urine infection, the common presentation would be somebody's having, for example, burning sensation on passing urine. They will pass urine more frequently. They might have a little bit of blood in the urine, and all of this can be associated with fever as well. And in that scenario, a urine infection would need to be excluded as a priority. In infancy, however, and especially in the first month or two of life, urine infections do not present like that. Common presentations would be a child who suddenly developed a fever for no obvious reason. A child who's beginning to vomit their feeds when previously he was tolerating all feeds normally. A child who's suddenly become just irritable and listless, or perhaps has undergoing color changes from his normal color to becoming a bit pale and a bit mottled. Other rarer presentations of urine infection might be in the first few weeks of life, when a lot of children have jaundice. A urine infection can cause that period of jaundice to be extended beyond the first week or two, or it can even cause the jaundice to be particularly severe. Uncommonly, urine infections can present in a more chronic way, with the child just not thriving rather than him or her developing any acute symptoms. It is very common for children when they present to A&E, therefore, because urine infections have such a wide and myriad of presentations, for urine infections to be excluded in any child who presents to A&E, for example, with unknown fever, unknown cause of fever, or with unexplained vomiting, or somebody who's just generally irritable and unwell. It would be routine in most cases to exclude a urine infection. And this is a reflection of how varying the presentation of urine infections can be in the first year of life. Most babies in the first year or two of life will have a nappy rash. In fact, I would say that if your baby doesn't develop a significant nappy rash, then you're very unusual, or you have done something very, very dramatic and different to majority of mothers throughout the world. There are rarer causes of nappy rashes, but the commonest two causes essentially are those associated with an infection, and in particular fungal infection called Candida. The other common cause of nappy rash would be simply contact nappy rash. The posh term for this would be contact ammoniacal dermatitis. Essentially, it means when urine or stools has been kept in prolonged contact with a baby's bottom without giving it time to dry up and heal. For these common types of nappy rashes, the treatment is generally straightforward. For Candida infections, children often need an antifungal cream to be used on a regular basis. For the contact type of nappy rash, there are barrier creams which sometimes are required. Some of these are mild, but occasionally more potent barrier creams are required.